6 months ago, many of you helped me get stem cell treatment for the peripheral neuropathy in my feet and legs that I suffered from the chemotherapy I received in my successful treatment for esophageal cancer 15 years ago. I got that stem cell treatment 5 months ago and have shown measurable improvement each month since. This time, however, I've been recently diagnosed with treatable stage 3 lung cancer. Treatable means that there are a wide variety of options available today that hold significant hope for curing this disease. About 3 years ago, I helped an author friend create a video describing an immunotherapy cure that's been in use for about 45 years. Here's an excerpt from it.
So the good news about this book is that the immune system vaccine that Dr. Virginia Livingston developed is still available today, 10 years after she passed away, and it works for patients with all kinds of cancers. The book tells how it all happened, how she developed it, Dr. Virginia, as we call her, how she discovered a cancer-causing microbe 50 years ago, and together with a renowned biochemist in the Northwest, developed a vaccine for all kinds of cancers. The medical community, as you might know, is now finally acknowledging that cancer is, in fact, an immune system disease. And the FDA has even approved already several vaccines for prostate, uterine, ovarian, certain melanomas, other kinds of cancers. Well, 30 years ago, Dr. Virginia was ridiculed for claiming the same thing. And the good thing about this vaccine also is that it doesn't require FDA approval because it's not a one-size-fits-all product. It's called an autogenous vaccine, which means it's made from each individual patient's tumor. And the first question I'm asked in some of my lectures is that if it's so effective and so cheap, why don't doctors know about it already? And the answer actually is twofold. First, they do know about it. The vaccine has been made for hundreds of oncologists and doctors all around the country, but their hands are tied. They're afraid of losing their license because the medical establishment has declared that if you're not doing surgery, chemotherapy, or radiation, they can take your license away. I've actually had a few oncologists tell me they're using the vaccine, but if I use their name, they'll sue me. And secondly, if you were running a $1 trillion chemotherapy industry, would you want to see a vaccine available to anyone for $2,000? I believe cancer affects every family in America, relatives, friends, neighbors, and every family should know about this vaccine. They should know that it's available, and they should know how cheap it is. And I think it's time for the medical community to acknowledge it as well, and maybe investigate what's going on with this. There's no prescription needed. Everyone can afford it. So thank you very much.
Immunotherapy as a cancer treatment seems to be an exploding medical treatment.
This is the destruction of a cancer cell by the body's own immune system.
You may have seen this TV commercial from the Biopharmaceutical Association that promotes this new technology. Additionally, it is being used at Stanford Medical Center, Cancer Centers of America, Dana-Farber Cancer Institute, Sloan Kettering Cancer Center, UCSF, and many other cancer treatment centers around the country. Additionally, CBS Sunday Morning did a major part of that program with a feature on it, as well as a full hour on immunotherapy on the PBS Charlie Rose program. None of these treatments, however, are covered by my Kaiser Permanente membership, and the cost has gone up about a third since that video was produced. I'm counting on my family and friends to again help me with this treatment. It's important that I raise enough money to cover the expenses of the treatment described in the Woman Who Cured Cancer video that I've just shown you, as well as co-pays and other living expenses to cover the loss of TV production work during the time of my treatment until I can regain my strength to fully work again. I'm told that I should see measurable results in about 2.5 months. Please help me to see a successful outcome to this treatment and get back on my feet again. Thank you for the time you took to look at this, and thank you for your generous donations.